Happy Monday morning, everyone, and thank you for being here this morning to discuss the current impact of the coronavirus in our community. Joining me today are representatives from the Baton Rouge Area Chamber, the Baton Rouge Clinic, Baton Rouge General, Pennington Biomedical Research Center, Ochsner Medical Center, Our Lady of the Lake, and Visit Baton Rouge. This morning is a call to action to our residents and to our businesses to be extra vigilant in the coming weeks. We have all seen concerning news from other states, spikes in COVID-19 cases across the country. We've seen the stories of hospitals becoming overwhelmed and patients having to be transported to other cities for emergency care. Last week, I publicly stated that once again, our own community is moving in the wrong direction. We are seeing an increase in our community's positivity rate. Also, new daily cases are on the rise. We believe that it could be the result of a number of activities, whether it was Halloween festivities or something that has been described, and you've heard it now, COVID fatigue. And so we are committed as an administration to protecting our health, the health of our citizens, and simultaneously keeping our economy open. And I firmly believe that we can achieve both of these things if we take the appropriate actions. These are nothing new. They involve wearing masks, avoiding crowds, washing your hands, and getting a flu vaccination. Baton Rouge was one of the early hotspots in the pandemic, facing 2 COVID spikes already. We already know what to do, Baton Rouge, and I really want to thank the majority of our residents and our businesses who continue to do the right thing to protect our health and economy. This morning, I want you not only to hear from me, but hear from also our healthcare and our business community to discuss the importance of being vigilant during this time. Next, we will have Dr. Saavedra, infectious disease specialist at Baton Rouge Clinic. She will be followed by Dr. Paul Minsky, CEO of Baton Rouge General, Paul Arrigo from Visit Baton Rouge, Dr. Ralph Datarvi, Vice President of Medical Affairs at Ochsner Medical Center, Coletta Barrett at Our Lady of the Lake, and then I will return. Dr. Saavedra.
Thank you. Like Mayor Broom said, I'm Dr. Tatiana Saavedra. I'm an infectious disease physician at the Baton Rouge Clinic. I wanted to touch a little bit on something that she mentioned, which is COVID fatigue, and what we can do in the upcoming weeks to remain vigilant in our efforts to continue to mitigate continued spread. We are starting to see rise in our numbers, not just here, but all over the United States. And if you really go to some of the dashboards that are available, you can see that the number of daily cases have exceeded over 100,000 over the last several days, and that's very alarming. I suspect that a lot of the reason why we're seeing this is that there is a component of people just being tired from, everything that we've dealt with starting back in March. I fully, appreciate that, and I get where people are coming from, but I just want to encourage everybody to not let your guard down now. It's possible we're starting to see that spike related to Halloween activities. I know that, some people did participate in trick-or-treating, and then others may have participated in parties and other get-togethers where maybe there were more people than there should have been. So I would encourage everyone to continue to wear your mask daily, everywhere you go, especially out in public, and to continue to keep that physical distance, because that's so important and we know that it works. And then certainly, as Mayor Weston Broom said, washing your hands often. And I would also encourage people out there that if you happen to become exposed to someone, to please follow through with the quarantine time, because I think that is part of the problem that we're seeing, is that there are some exposures that are happening, and the recommendations made to quarantine for the 14 days, and I think we might be seeing people not quite following that as strictly as they were early on. And that's certainly concerning, because those people could then go on to potentially, expose others and spread it unknowingly. So certainly masking up is important. And then I know that we're going to talk a little bit more about the importance of flu vaccination, and then also holidays coming up and things that we can do. The CDC is an excellent resource to go to. They have some links and recommendations as to how to prevent further spread with the holidays coming up, especially Thanksgiving and Christmas. The Infectious Disease Society of America, or IDSA website, also has an incredible number of resources with more information that I think would be very helpful to the public. But right now, I think the most important thing is masking up and trying to avoid those places that are crowded. And so crowded restaurants, bars, gyms, those kind of things. And then just, again, being vigilant. I think we've come this far, and we know what doing these things can do in terms of mitigating the spread. So I want us to get back to that point. I don't want us to see another huge spike. I don't want our hospitals to get overwhelmed. I don't want our fellow healthcare workers to continue to get overwhelmed, because it is exhausting. So just mask up. Thank you.
Thank you, Mayor Broom, for having us again. I'm Dr. Louis Minsky. I'm the Chief of Staff at the Baton Rouge General Hospital. And there's no doubt that we are all very tired. This is 9 months that we have dealt with this pandemic. We've been told what we can do, what we can't do, what we should do, what we shouldn't do. But we're not there to the finish line yet. We have a little ways to go. The good news is that the first vaccine has announced that it should become available by the first of the year. Early this morning, the second vaccine was also reported to be near completion and ready. And so we will have help to get to the finish line, but we have to stay vigilant at what we do. This morning, the Baton Rouge General had 2 ICU beds available. Our COVID ICU rooms are filled. We've seen this happen twice this year, where we've gone to capacity and expanded. We know that we can't stop this virus without help from a vaccine. We know that social distancing and wearing a mask is not going to stop this virus. But what it will do is slow it down. It will flatten that curve. It will allow us to be able to deal with the cases that arrive. We will be able to take care of the patients who fall ill enough to be at the hospital. Many of us won't get that sick, but there will be some, and we can't predict. So we're all very, very tired of putting on a mask, of wearing a mask when no one else wears a mask, but it's necessary. It's important that we remain vigilant. We have 246 deaths in the United States as of this morning. We don't think about the 300,000 other lives that have been lost in an unexpected mortality because of other illnesses, heart attack, stroke, cancer disease, where patients have put off their chronic well care. They've put off going to the emergency room. They've been scared to have surgery because they didn't know what will happen with the COVID virus. One of the safest places to be right now, perhaps, is the doctor's office or the hospital. So it's important that while we stay vigilant, while we protect ourselves and our community, friends, and neighbors and family members from this virus, it's also important that we take care of ourselves and we continue to address those very important chronic needs. So while 2020 seems like it's been a very long year, it's a very short time in our lives. Such a short portion to do the right thing, to wear a mask, to be vigilant, to protect our families, to protect our community, our neighbors, and fellow Americans. And let's get through this together, just as we did through the first wave and the second wave. Mayor, thank you again for having us.
Thank you. In 2018, over 12,000 persons were employed by the hospitality industry. Visitors left over $1 billion in this community. No industry has been affected more negatively than the hospitality industry, restaurants, hotels, and attractions. We understand the need to control the pandemic. We've got to all work together. We've got to get back to where we are, and I think it's up to each and every one of us to concur with the decisions and with the recommendations that are made today. Thank you very much.
Good morning. I'm Dr. Ralph Dotree, Vice President of Medical Affairs at Ochsner in Baton Rouge. I want to thank the Mayor for having us out here today to reaffirm the message that we're giving you today. I want to also add to what Dr. Minsky said. Doctors' offices and hospitals are probably the safest place to go. If you're sick, do not be afraid to come in. We're taking the proper precautions, and it's actually safer than most public places that you would go. With that being said, the next point of safety is it's flu season as well. And this started on the tail end of flu season, and when that was beginning, it was very difficult to differentiate those people who were having the flu or the new COVID virus. We had to do double testing. Testing was difficult to get, but we worked our way through that. We're prepared this time. We can do the testing a lot quicker, but this highlights very important to get the flu vaccine this season, more than any other season ever before. We know that we can vaccinate for the flu. We know it makes a difference. The flu vaccine is readily available, and we have a methodology in which to give it almost anywhere. So we really need people to get the flu. Remember, the symptoms are very similar between the regular flu and the COVID virus. If you get the flu, it could decrease your immune response to the COVID virus, and you may result in a higher risk of morbidity and mortality from the COVID infection. We're still fighting this whole epidemic. We've got a chance. We know that the next vaccine is around the corner, but very important to get the flu vaccine. And if you have any trouble with access, contact your healthcare provider, contact the hospitals, contact the various clinics in the area. Flu vaccine is easy to get, and everyone should get it. Thank you, Mayor, for having us again today.
Good morning. Colette Barrett, Our Lady of the Lake Regional Medical Center. I'm a registered nurse and a member of this community for 44 years. I understand our desire to come together at Thanksgiving to be thankful for the many blessings we have. But it is an opportunity, it is a time for us to be extremely vigilant. We encourage you to continue to connect virtually. I know no one wants to hear that, but that is the safest way for all of us to remain connected during this Thanksgiving time. If in fact your decision is to come together as families, you're encouraged to be outside and still 6 feet socially distanced in your families. If you have a tent, please do not enclose the tent. You have to have the ventilation go through the tent. So these types of outdoor mitigations are important. As the host to one of those events, I strongly encourage you to mandate that your guests wear masks all the time except when eating or drinking. We must stay vigilant, as you have heard. If in fact you will host a family gathering, first is we're encourage people to bring their own food. It's cooked as part of their normal family. If in fact that's not what happens, require your chefs to wear their mask, require your chefs to wear their gloves. And when serving, it is not a buffet style anymore, guys. We can't do that. What we must do is have an identified server who has mask, gloves, and we individually serve people as they come through. It is important that we be vigilant, as you've heard this term multiple times, about containing the spread. It is it is highly probable that if unmasked and sharing meals, and talking as loud as we often do during family gatherings, we will increase the spread of the virus. If you have members of your family that are susceptible, meaning they meet any of the risk factors, or they have been told, they've been sick, they've told you they're ill, please ask them to uninvite themselves to your event. The most vigilant of us told our family members last Friday, you must now self-isolate for the next 14 days if you're going to come to my house on Thanksgiving Day. That is another way to mitigate exposure. But once again, you've heard consistently, wear your mask, social distance 6 feet apart from family units, and wash your hands, wash your hands. That still is important if you have family gatherings, whether it's Thanksgiving and we wind our way into Christmas. Please be safe. Thank you.
Thank you to all of our speakers this morning, some very valuable information. And thank you to our residents and our businesses who have worked hard throughout this process to keep our economy open and protect our health. Together, I firmly believe that we can keep Baton Rouge safe and continue to move in the right direction. With that being said, I'll take any questions that you might have. I'm going to start over here and go that way.
Is there a point, a threshold, where you'll consider taking more restrictive measures than the state is already taking, maybe like we've seen in other cities?
That is not my intention at this point. As you can see by the speakers that we have here, I value the information of our medical community. I value certainly the information of our other community stakeholders, our businesses, and I will not make a determination on that without getting the counsel of the medical community especially. The data is what drives us to make decisions, and so we are here today to continue to encourage and implore our citizens to move in the right direction so we don't have to make any backward steps. Yes?
My question is for the people at the hospitals. I know the number of beds available in BRG was, as Baton Rouge General mentioned, 2 available beds in the COVID unit. Where are we with the other 2 hospitals, and are we seeing people in other parts of the state coming here once again for that care?
I'll let the hospitals respond to that question.
So, Dr. Daughtry from Ochsner in Baton Rouge. Our hospital right now has capacity. We're at about 12 patients with COVID right now. Our ICU has capacity, and we're running on our basic ICU beds. We have the ability to expand, but we're not in that. We haven't been in that mode since April or May. So right now we have capacity. We are always accepting transfers into the Ochsner system, but no more for COVID than we've been normally accepting.
Thank you. Colette Barrett with Our Lady of the Lake. One of the things I would like to share with you is that we as a community have come together since early March. The medical providers, the leaders of all the hospitals have a weekly conference call on Monday night at 5 p.m. where we share capacity, capability, concerns, have discussions, and come together to make sure that we're keeping our community safe. So as one hospital may be challenged, in whatever it is that we're challenged, in the early days it was PPE, it was beds, it was ventilators, all of those things we've come together as a collaborative, and we work together to make sure that we solve any of those problems or issues for our community.
Are you part of the press, sir?
Excuse me?
Are you?
No, I'm part of the press. I want to ask a question if I could.
Let me take questions from the press first. And Mark, you might want to see what's going on there. Yes.
Is there going to be another push for more testing? Because I know, early on when we saw the surges, that there was a huge push for more testing and more surge testing. Are we going to, is there an idea that maybe we may go back in that direction?
Well, certainly, we are encouraging our citizens to access the testing that we have available. We have over 40 testing sites now. We've come, as they say, a mighty long way since we first started out with having accessibility to tests as well as testing sites. And so we want to encourage people, if they have the symptoms, if they feel that they've been exposed, if they have those type of concerns, to access one of these 40 sites that are available, and will cover a plethora of situations, whether you have insurance or don't have insurance. We have federally qualified health centers, et cetera. So we're going to continue down that path of encouraging people to access some of those 40 testing sites.
Are you confident that the people here in Baton Rouge will heed this warning, and especially as we head into the holidays, we talked about Thanksgiving, and I have Christmas coming up before too long, the big gatherings. Are you confident that we'll be able to?
I have faith in the people of Baton Rouge. I believe in the people of Baton Rouge. And so that's why we just took a moment this morning to pause, to encourage, to give an update, to say keep on in the positive direction of mitigation that we have. Continue to adhere. And so, yes, I do believe that we will see the citizens of Baton Rouge respond accordingly as it relates to mitigation. Listen, at the end of the day, as you've heard from our hospital providers, as you've heard from our business community, we have a shared goal, all of us as citizens, and that goal is that we want to minimize the individuals, certainly, that become impacted by COVID-19. We want to keep our city open for business and moving forward, and we want people to be safe. And it's doable. It is definitely doable, as you heard from our medical community. Since March, we've been able to navigate even those instances and seasons when we've had spikes. So this is a clarion call to let's not let our guard down. Wear these masks. Wash your hands. I love what Colette said about the family gatherings. This is what I describe as short-term discomfort for long-term gain. We're right on the brink of having a vaccine, hopefully, and the doctors can either shake their heads, yay or nay on this, but hopefully by this time next year, we will have crossed over into a vaccine that people will have access to. So I remain optimistic about the citizens of Baton Rouge and East Baton Rouge Parish. Thank you. Okay.
Sorry. I know, early on, the number of deaths and the people who contracted the virus, we saw an older group of people. Further into the pandemic, we saw more younger people. Where are we now? Is it a mix, or is it still those younger people who still feel like, oh, I'm 21 years old and I'm still invincible, I'm not going to get this, but I could possibly pass it to my grandfather?
Dr. Saavedra, would you like to answer that? She is our infectious disease specialist. I have my own ideas, but I'll let the specialist speak.
I do think, like you mentioned early on, we were seeing it primarily in our older patients, and over the summer and kind of in those months, we saw a much younger demographic. I think now we're still seeing pretty young college-age people get the virus, but then we also are seeing middle age as well. It was kind of a good mix. But I do suspect that a lot of this kind of COVID fatigue and letting their guard down is in that kind of young adult age group that we're dealing with. And so that's why, again, just trying to implore everybody to do what's right, wear the mask, and try to avoid those crowded places. because, I mean, we know, when you sit in a bar, you sit in a restaurant, and it's not well ventilated, and you're taking off your mask because you're eating or you're drinking, especially if alcohol's involved, you're going to see people really let their guard down, and people aren't going to physically distance and things like that. So I do think now we're seeing some of that, and I mean, we can say it, bringing up LSU football season and just, the cases that they saw on the team themselves. So I think it's just something to be on the lookout for, and certainly that age group, but everybody else, just to do the best that they can.
Thank you. Any other questions?
Mayor, if I can, I'd like to switch topics. Are you pleased with how BRPD is handling the Fillmore investigation, and when do you anticipate the public will be able to see that video?
Well, let me just say that we have been working since I took office to close the gap between our police department and the citizens in our community. We have to take all of our complaints of this nature very seriously. And as I said, we have made progress, but we have to continue to be relentless in our efforts to ensure that our citizens trust that all citizens will be treated with dignity and respect in every encounter that they have with the police. And so I believe in the leadership of Chief Murphy Paul and his team. He's consistently demonstrated his leadership even over the past few days, and having met and reached out to Mr. Moore, his family, and others. And so I'm confident that Chief Paul will make the video accessible sooner than later as he moves through this investigation. As I have said time and time again, I think it's important that the investigation is expedited so we don't have that cloud hanging out there. And I believe in Chief Paul's leadership and the leadership of the Baton Rouge Police Department.
Have you seen the video?
I have not seen the video.
That's going to be it, everybody.